Hello, this is Lorie Fularz, and this is my PowerPoint presentation for pathological condition. My pathological condition was type 2 diabetes. I'm going to start with giving you a description of type 1 diabetes, and that is caused by the immune system destroying the cells in the pancreas that make insulin. Diabetes is then created because the body is not producing enough insulin to function normally. This is called an autoimmune cause because the body is attacking itself. Type 2 diabetes is usually caused by having a family history of this that runs in your family. There are a variety of risks like obesity, bad diet, and just plain getting older, which runs in my family. That's why I chose this pathological condition. Type 2 diabetes also can affect pregnant women. This is called gestational diabetes, even though it is considered to be type 2 diabetes. The cause of diabetes vary depending on certain things, such as your genetic makeup, family history, ethnicity, health, and environmental factors. It has no common cause, but if certain diabetes, if you changed your diet and did some more exercise, you could probably reverse some of the effects and not have to take medications for. So depending on the type that you have, you might be able to fix it so you don't have to be medicated for it. Diabetes goes undiagnosed by 8.1 million people in the United States. And in 2012, 29.1 million Americans, or 9.3% of the population, have diabetes. Most Americans don't know that they carry diabetes or have diabetes until they're admitted to a hospital for other reasons and then find out during blood tests. The percentage of Americans age 65 and older, it remains high for them. They're the highest level at 25.9%. or 11.8 million seniors have it. Type 2 diabetes affects all parts of the body, causing seriously potential life-threatening complications. As you get older, it can cause you to lose feeling in your limbs. You can get infections and not realize you have infections, and then you have to have things amputated. You could have your toes, your legs, things amputated because you have no feeling in them and you don't realize that they're infected. Type 2 diabetes also affects multiple organs such as the liver and the kidneys. I know that when my grandmother passed away from diabetes, it caused the shutdown of all of her major organs, and then she passed away from this disease. The signs and symptoms of type 2 diabetes could be you could be thirsty all the time, have excessive hunger, you want to eat, and you're always wanting to go to the bathroom to urinate. You always have to pee. You could suffer from weight loss or increased susceptibility of infections, especially yeast or fungal infections. If you have extremely high blood sugar levels, it can lead to dangerous complications like hypersomnia syndrome. Hypersomnia syndrome is a life-threatening form of dehydration. In some cases, this is the first time that a person has type 2 diabetes. Hypersomnia syndrome can cause confused thinking, weakness, nausea, and even seizures and coma. Too much glucose-lowering medicine relative to dietary intake can lead to the complications of low blood sugar called hypoglycemia. And if your blood sugar gets too low, it could cause you to pass out. So you should always, if you have diabetes, carry some form of candy or fruit or something that produces sugar in order to keep your sugar level normal, or at least normal enough for you to not be affected. Atherosclerosis. which is a fatty buildup in the arterial walls, can impair blood flow to all of the organs. The heart, brain, and legs are most often affected. Neuropathy is nerve damage. The nerves to the legs are damaged first, causing pain and numbness in the feet. This can advance to cause symptoms in the legs and hands. Also, damage to the nerves that control digestion, sexual function, and urination can also occur. Tiny blood vessels within the retina can become damaged by high blood sugar and can block blood flow to the retina, leading to bleeding into the retina that can eventually cause blindness. Now, my grandmother had the eye disease, glaucoma, which was causing her to go blind. She passed away before it got that far. So I know that it can cause those side effects. So if you can do anything to reverse the effects of this disease, you should try hard to do so. Diabetes cannot be cured, only maintained. Only through proactive lifestyle changes, including changes in diet and proper exercise, can the disease be controlled. Oral medications are also vital to the success of trumping the disease and its symptoms. Constant monitoring of blood sugar levels are also essential for proper control of this disease. Most people have to stick their fingers and check their blood sugar levels throughout the day in order to maintain the right amount of sugar in their system. And these are some of my references that I have. How's diabetes treated? Monogenetic forms of diabetes, neonatal diabetes, mellitus, and maturity onset diabetes of the young. How to prevent diabetes, monogenetic forms of diabetes, neonatal diabetes mellitus, and maturity onset diabetes of the young. Treatment and care, and diabetes treatment. Thank you.